we have mentioned all this. Avoid limbs where there has been lymph node dissection. Okay, this is, so I would just like to highlight finally this two-syringe technique of administration of these drugs. So this is recommended in children. Once you select an appropriate vein, you can begin a new IV line with a 23 or 25 gauge needle. So flush the line first with about 10 ml of normal saline. Then assess for a brisk full blood return and any evidence of infiltration. Check for swelling, redness, pain at the site. And once access is ensured, then you switch to another syringe which contains the vesicant. So it is not that you just take that and take the same syringe and keep aspirating whether the blood is coming or not. So you should always have two syringes, preferably in all patients and more so in children. So that whenever you first use a syringe which just contains normal saline, flush it, aspirate it, then go for the syringe which contains the vesicant. Always use a two syringe method, not a single syringe method where you try to manipulate. And with a continuous infusion, of course, you again have to confirm placement and inspect the needle site every 2 hours for signs of infiltration or dislodgement. Infuse the drug using an infusion pump and teach the patient also, this is also important, that the patient also should be informed as to what are the signs and symptoms he should be looking for. If you have itching, if you have pain, if you have something, please tell us. Some patients are extremely tolerant. So in conclusion, I would just like to re-emphasize that extravasation injury, particularly with chemotherapeutic agents, can be extremely serious. It can be serious to the patient. It can be serious even to the doctor if he has to go to the court. However, the consequences of such an occurrence can be greatly minimized through careful preparation, administration and monitoring of intravenous infusions of vesicant antineoplastic agents. Such treatments should be undertaken only by persons experienced in venipuncture techniques and chemotherapy administration. Thank you. Any questions from the chemotherapy sisters?
DMSO topical agents available, sir?
It is available. I think, in fact, there was a slide, in fact, I think which we should actually have in all the wards which are administering chemotherapy. There is a extravasation kit. So exactly the things that are required. So just like an emergency tray kind of thing, you will have an emergency kit. It is in one of, I have a slide on that. Exactly what are the things you require, the gauze, the DMSO, the hyaluronidase, etc., etc. So exactly what all is required is mentioned there. And I think we need to prepare a kit and keep it in all these wards. Just like an emergency tray, we can have that.
So, আমাদের এখানে available হবে?
Similarly, noradrenaline is very important for noradrenaline drugs. If you are giving and coming out, it will necrose the different tissue. So, very common drugs in practicing. Whenever you want to give in a hurry, always keep the line is at the right place. Because it is a common drugs. So be aware of that for the necrosis.
Norad can cause necrosis. Of course, the mechanism is different because that will cause vasoconstriction.
Yeah.
And these drugs, they generally will bind to DNA and cause necrosis.
Second system.
Okay. Thank you all for the patient hearing.